Inflammation is a normal body process, and is usually a good thing, but it can sometimes go out of control too, which we will examine in this series. In this video we will show how inflammation can be part of many dysfunctions and a big part of cancers. Please stay to the end as this information relates to many other issues too. Before we start, could we ask you to please subscribe and click the like button so the algorithm will spread this information to more people? Many thanks. In neuroinflammation, the brain's immune cells, called microglia, become activated. While they protect the brain, chronic activation can harm healthy neurons and disrupt brain function, potentially contributing to neurodegenerative diseases like Alzheimer's and Parkinson's. In the case of glioblastomas, an aggressive type of brain cancer, inflammation can play a role in tumor growth and progression. Now, let's talk about inflammation's connection to cancer. Chronic inflammation, whether from smoking, obesity, or infections, can increase the risk of cancer. New research shows that a component of inflammation, TNF, tumor necrosis factor, is a big part of every known aspect of cancer, so a direct contributor. Inflammation can stimulate cell growth and damage DNA, potentially leading to the development of cancer cells, including glioblastomas, a challenging and deadly form of brain cancer, also made from glia cells. Meningitis is an inflammation of the protective membranes covering the brain and spinal cord. It's often caused by infections, or other inflammation, such as mastoiditis, and can be life-threatening. TNF is also a highly suspected piece of the insulin resistance processes seen in many neurological issues. Early recognition and treatment are crucial to prevent severe complications. So, why is all this information important for you? Understanding inflammation and its various forms can empower you to take steps for better health. Inflammation levels can be checked by measuring different markers. Dietary and other changes can have high value. Clinical studies on the use of red light therapy, photobiomodulation devices, demonstrate some can reduce inflammation levels and even have other benefits. Vagus nerve stimulation has also been shown useful to reduce inflammation levels as it can regulate sympathetic nervous system responses like inflammation. Low-carb diets like keto have also been shown useful to reduce inflammation levels as it can use ketones like beta-hydroxybutyrate, which can block inflammation responses. Be aware of your family history. If you have a family history of neurodegenerative diseases or cancer, it's important to stay informed and discuss your risk with a healthcare provider. Seek medical attention. If you ever experience symptoms like severe headaches, stiff neck, or confusion, don't hesitate to consult a doctor. Early diagnosis and treatment are crucial, especially when it comes to meningitis and conditions like glioblastomas. By understanding it and taking proactive steps, you can help protect yourself against the negative effects of chronic inflammation, cancer, infections like meningitis, and even issues like glioblastomas. Information here is simply a terms of reference guide to understand the context of these videos. Please see the video description for training resources if you are interested.